Thank you for your interest in Natera's Spectrum preimplantation genetic screening. We hope this brief presentation will be able to answer many of your questions about our testing. Natera's parental support technology is a type of aneuploidy preimplantation genetic screening, or PGS, which is used during IVF to look for chromosome errors in embryos prior to transfer. Sometimes this is referred to as preimplantation genetic diagnosis, or PGD. Preimplantation genetic screening at Natera is performed on biopsied cells from day 3 or day 5 embryos. However, the difference with parental support microarray technology is that it includes an additional step which uses data collected from parental samples to create a background map of each parent's chromosome information for comparison to the embryo results. In this way, parental support testing creates highly reliable and accurate results for all 23 pairs of chromosomes. In this presentation, we will provide a brief overview of Natera's parental support technology, including the purpose of the testing process, and the limitations and benefits of the testing. We will also discuss how the results will be reported out to your doctor. This presentation is meant to provide you with basic information about our test. If you have additional questions about Natera's Spectrum PGS after watching this video, we are happy to schedule a one-on-one phone genetic counseling session for you with one of our board-certified genetic counselors. Chromosomes are structures in the cells of our body that contain the genetic information that tells our body how to grow and develop. Normal human cells contain 46 chromosomes, or 23 pairs. Half of our chromosomes are inherited from our mother and half from our father. When there are too few or too many chromosomes in a cell or an embryo, this is referred to as a chromosome abnormality. A chromosome abnormality can happen in any pregnancy and is the result of a random error either in the egg, sperm, or one of the very first cells of the embryo. Although anyone can have an embryo with a chromosome abnormality, the risk increases with the age of the mother. Natera's parental support test is designed to detect missing or extra chromosomes across all 24 chromosomes. This includes the numbered chromosomes 1 through 22 and the X and the Y chromosomes. The majority of embryos with chromosome abnormalities will not implant or will result in an early miscarriage. By testing embryos for abnormalities across all chromosomes, you enable your IVF doctor to select those embryos most likely to be chromosomally normal for transfer, which may increase the chance that you will become pregnant and may decrease the chance for a miscarriage. Day 3 or day 5 embryos tested with parental support will be frozen and transferred during a later cycle. Test results are typically returned to your IVF doctor about 1 week after the sample is received by Natera. Parental support testing is a two-step process. The first step you may have already completed, which is sending in parental DNA samples either through a cheek swab kit sent directly back to Natera or a blood draw done at your IVF center. If you wish to send cheek samples, we prefer them at least 1 week in advance of your embryo biopsy. Blood samples can be sent in any time prior to or at the same time embryo samples are sent. The second step is collection of the embryo DNA for testing at Natera. The parental samples you submit are used to create a background map of approximately 300,000 DNA markers called SNPs, on average about 10,000 SNPs per chromosome. Use of parental DNA as reference is unique to parental support testing and enables us to test for missing or extra chromosomes across all 24 chromosomes with high reliability. No specific testing for disease-related genes is done on your parental samples. We simply use this information as reference data for testing your embryo samples. To collect the embryo DNA, an embryo biopsy will be done on each of your embryos. The biopsy can be performed on day 3 or day 5 after fertilization by an embryologist at your IVF center. Day 3 embryos will have 1 cell removed. Day 5 embryos will have a small number of cells removed from the trophectoderm, or TE, the tissue that will become the placenta. These samples, that is 1 set of cells for each embryo, will be sent to Natera for testing via medical courier for same-day delivery. The embryos will remain at your IVF center. Test results are usually available within 1 week. As long as your consent forms and payment information are received by Natera, results are sent to your IVF center as soon as testing has been completed. Research has identified some specific groups of people who may benefit from aneuploidy PGS testing. Because PGS technologies are relatively new, there may be clinical benefits for other groups as well. Some centers advocate for PGS for all patients, including egg donors, because of the high pregnancy rates with the transfer of a single embryo. Women who are 35 years or older are known to be at a higher risk of having a pregnancy with a chromosome abnormality. Therefore, aneuploidy PGS testing may be useful in selecting embryos for transfer that are most likely to have normal chromosomes. Some studies of couples with more than one miscarriage of unknown cause have shown a higher rate of embryos with chromosome abnormalities than expected. These couples may also benefit from aneuploidy PGS testing. For couples with 3 or more miscarriages, it is recommended that both parents have a routine chromosome analysis done to rule out a balanced rearrangement. This study can be discussed further with your doctor. Couples who have had a prior pregnancy or a child with a chromosome abnormality, who are concerned about having a child with a chromosome abnormality, or who are interested in pursuing a single embryo transfer, may choose to use PGS to reduce the risk of transferring an embryo with aneuploidy. Lastly, there is data that suggests for some couples with previous unsuccessful IVF cycle or cycles, aneuploidy PGS may increase the rate of pregnancy. Parental support calculates a test confidence level specific to each individual embryo sample and each chromosome within each sample analyzed. Some samples have poor quality DNA and may not return results with our usual confidence levels of greater than 99% for all chromosome pairs. Thus, if there is lower confidence for a particular chromosome within a tested sample, your doctor will know exactly which chromosome it is and the degree of risk for misdiagnosis based on the listed confidence levels. This information can be helpful in making the best clinical decisions about transfer. In addition to testing for chromosome abnormalities in all 24 chromosomes, Natera's parental support testing can also detect uniparental disomy, or UPD. That is when both copies of the same chromosome come from the same parent instead of one copy coming from the mother and one copy coming from the father. If a UPD is clinically significant and could result in a child with a known genetic syndrome, Natera will report out that finding as abnormal and not recommended for transfer. Our testing can also identify large missing or extra pieces of chromosome material, deletions or duplications, in all 24 chromosomes. Missing or extra pieces of chromosome material in an embryo can cause miscarriage or the birth of a baby with multiple birth defects, and these findings are reported out as abnormal. Lastly, parental support testing can also determine the parent of origin for chromosome abnormalities. This can be helpful in looking for patterns of chromosome abnormalities. There are limitations to all forms of PGS testing, which are outlined here. Natera's parental support PGS does not screen for genetic diseases such as cystic fibrosis or hemophilia. If you have a family history of a genetic disease and the familial mutations are known, it is possible to set up a custom PGD test for those mutations, but this process takes months and involves a different testing method. If you are at an increased risk for having a child with a specific single-gene disorder, you should discuss this with your IVF doctor, who can refer you for PGD testing specific to that disorder. There is a chance with each embryo sample tested that we could return no results or partial results. Typically, this happens when the DNA for that embryo sample is degrading prior to Natera testing, or when we receive a cell that has no nucleus and thus no chromosomes to test. This happens approximately 5% of the time with day 5 testing. With PGS testing, we are unable to completely rule out mosaicism, a condition in which some cells of an embryo have a different number of chromosomes than the cells tested. Testing done on embryos biopsied on day 3 looks at only one cell, or at the most 2, from each embryo. Therefore, we cannot confirm that the cells in that embryo have the identical chromosome number. Studies have shown the rates of mosaicism to be between 15 to 40% for embryos biopsied on day 3. Day 5 testing looks at cells from the outer layer of the embryo only, the TE. Therefore, we cannot determine if the cells in the inner mass of that embryo are identical to the cells in the outer layer. The rate of mosaicism with day 5 testing seems to be lower, approximately 4%, but not 0. This is one reason why prenatal diagnostic testing, either a CVS or an amniocentesis, should be discussed with your healthcare provider for a pregnancy achieved after using IVF with aneuploidy PGS. There is also a chance that all results will show chromosome abnormalities, and there will be no embryos with normal results to consider for transfer. This chance increases with the age of the mother and in cycles with small numbers of embryos to test. We will discuss these chances in more detail on the next slide. There are many reasons besides chromosome abnormalities that pregnancy may not occur after IVF transfer. Therefore, there is no guarantee of pregnancy even after embryos with normal chromosome results are transferred. In addition, we know that the risk for anyone in the general population to have a child with some sort of birth defect is about 3 to 5%. Parental support testing is only able to test for the subset of birth defects caused by chromosome abnormalities and cannot rule out all birth defects. Based on our data on day 5 testing and the medical literature, we know that a significant proportion of day 5 embryos have one or more chromosome abnormalities. What we have seen in our patients thus far is that for women younger than 35 years old, the chance for chromosome abnormalities in each day 5 embryo tested is approximately 35%. For women ages 35 to 39 years, the chance is about 50%, and for women 40 years and older, the chance is 75%. The rates for chromosome abnormalities are even higher in day 3 embryos. This means that for older women, there is a higher chance that you could have fewer or even no normal embryos to choose from for transfer. The more embryos you have to test, the higher the chances that at least one will have normal results. However, there is always a chance for no normal results. Natera's parental support testing is still a fairly new technology, having been in clinical use since October of 2008. During this time, it seems that we are seeing an increase in the clinical pregnancy rate and a decrease in the miscarriage rate for our patients when compared to individuals using no aneuploidy PGS testing or other forms of PGS testing, although a formal randomized controlled trial needs to be conducted to give statistically significant numbers. Currently, we have a 65% overall pregnancy rate for our patients. The benefits outlined here may be due to the fact that we are able to screen all 24 chromosomes, something not possible with older methods of aneuploidy PGS. Additionally, our testing has been validated in preclinical trials with results published in the medical literature and averages 99% or greater confidence in the results returned, making this a more reliable aneuploidy PGS method than offered in the past. Your test results from Natera are confidential and released only to your IVF center. When the results are reported out, they are placed into 3 categories. The 3 possible categories are normal, abnormal, and no results or incomplete results. The first category, normal, are the embryo cells that do not have any chromosome abnormalities. These are the embryos we recommend for transfer. If you have multiple embryos to choose from in this category, they will be ranked in order of our overall confidence levels, with the cells having the highest confidence results being first. The second category includes those results in which one or more chromosome abnormalities were found. These embryos are usually not recommended for transfer. The third category includes those samples in which we could return no results or incomplete results due to either the lack of DNA or poor quality of the sample received. If you have any more questions about Natera's parental support testing and how it relates to your specific IVF cycle, we would be happy to schedule a one-on-one phone consultation for you with one of our board-certified genetic counselors to review Natera's Spectrum PGS testing. These sessions typically take about 30 minutes. You can contact Natera by email to request a genetic counseling session. Additionally, you can refer to the frequently asked questions on our website. Thank you.